Hi, my dear doctors. Today I'm going to discuss something about the pathologies related to the shape of RBC, and this uh, slide I took from USMLE first aid book, and I think this is very important for all of you to know that what all the pathologies we can see in case of the structure of RBC. Okay, so because sometime it is very important, and these pathologies and these structural changes, they give you a spot diagnosis. Okay, for example, in case of sickle cell anemia, and if you are unable to find the physical examination or the clinical history, then on the basis of the structure, on basis of histopathologies, you can easily find the cell and the structural anomaly, and then you can go for your diagnosis. And sometimes it's easy, so it's very important to know that all of the things or the structural changes in RBC. So we'll go for the first one, that is acantholysis. So you have already stated in pharmacology that there is a spinous layer, and in some pathologies there will be a damage between the junction between the spinous layer of the cells of the spinous layer, the keratocytes, and that condition when there is the junction between the cell, the lows, that is what we call as acantholysis. The same, so acantho mean, they already said it's a spiny. So what happens in this condition, normally the RBC, they change their structure, there's certain structural changes, like the RBCs become a spiny spinous like cells having projections, and the projections are quite large and they are not uniform. So in that condition we can say that this RBC is undergone some acantholytic changes, and that RBC is what we call as the acanthocyte. So if you want to study what they wrote here, so okay, so what is acanthocyte? It's also called as the spore cell. It's a can see in liver diseases like beta lipoproteinemia. It's a state of cholesterol dysregulation, and they already said that acantho mean spiny. The second pathology is basophilic stippling. We can see that the blue spots into the RBC. So when we can see the basophilic stippling, it's in case of sideroblastic anemia, for example, lead poisoning, myelodysplastic syndrome, and thalassemia. They are pathognomic for these diseases. So seen primarily in the peripheral smear and versus a ringed sideroblast that can see in bone marrow. So if you take a peripheral smear blood sample, then in that sample you can find these RBCs with basophilic stippling. So what are basically they are? They are the aggregation of residual ribosomes. And the next one is dacrocytes. Dacro mean tear. Okay, so here teardrop cells. The RBCs, it's appear like a teardrop, as you can see here and here as well. So these are the dacrocytes. So when we can see dacrocyte in case of bone marrow infiltrations, for example, myelofibrosis and thalassemia. So RBCs or sheds a tear. You can say RBC sheds a tear because it's appear like a tear because it's mechanically squeezed out of the bone marrow in the bone marrow. So in case of myelofibrosis, what happened? The bone marrow become fibrotic, and the protection of the new cells is very less, and the bone marrow become hard. So because of that, there is a mechanical squeezing and mechanical damage to that of the cells, and because of that mechanical squeezing, the RBCs appear like a teardrop. So it's a quite good pathognomic feature of the myelofibrosis. The next one is the Digmasites. So Digmasites is also called as bite cells. So in this condition, what happened? It seems like that half of the RBC is cut off. See here, but it's not like that. Okay. Now, if there is any damage to any cell and the cell membrane once damaged, then the cell completely lost or completely damaged. So in this condition, what happened? It was an old concept that in case of certain diseases, like they already said about the G6 PD deficiency, glucose 6 phosphate deficiency. So in that condition, the RBCs, the half of RBC is cut off, and because of that, the cut portion of the RBC is not visible. But now with the recent studies, they are saying that this is not a true hypothesis. This was not a true hypothesis. According to the new theory, they said that there is a accumulation of certain granules or particles in that area that don't stain is the other part of the RBCs. Okay, so there is no staining in this particular area. So because of that, it seems like a bright cell, and this is a pathognomic feature for that of glucose 6-phosphate deficiency. The next one is that of echinocytes is a bar cell. Okay, it's quite has some similarity that of the acanthocytes, but the difference between the acanthocyte and the bar cell is that in acanthocyte the spinous process was large and uneven, but in this case the acanthocytes are uniform and they are smaller. Okay, so when we can see these acanthocytes in case of end stage renal diseases, liver diseases, pyruvate kinase deficiency. And the difference from the acanthocyte, its projections are more uniform and smaller. So the next one is that of elliptocytes. So it can see in conditions like hereditary elliptocytosis, usually asymptomatic, causes by mutation in a gene encoding RBC membrane protein, that is spectrin. Spectrin is a very important structural component of the RBCs that gives flexibility to the RBCs that maintain a structure of the RBC. So once there is genetical mutation that leads to a mutation or structural changes in spectrin. So once there is a structural changes, then the RBC loses its original structure and it's changed into ellipsoid structure. Because of that, we can see it is a elliptocytes. And the next one, there is macroovelocytes. It's very simple because we can see if we compare the normal RBCs here, okay, the central one RBCs are quite big and it's like an oval, like an egg. So why RBCs become big? Because you know that whenever there is a formation of RBC, the RBCs initially when they start to form in the bone marrow, they are quite large in size. Okay, and they undergo maturation and differentiation. So because during the process of maturation, the RBC size start to gradually decreases, and for the maturation, and we all know that vitamin B12, vitamin B9, and folic acids, they're very important for the maturation. So once there is a deficiency of the folic acid, deficiency of the we can say the vitamin B12, and then the RBCs, they don't go in a state of in maturation. They don't mature properly, so they are immature. So once they are immature, then their size is we can see quite larger than that of the normal RBCs. So because of that, it's appear like a macro ovelocyte or oval shape, okay, in big egg. So that's why it is called as the macroovelocytes. So macroovelocytes can see in case of the megaloblastic anemia, and in this condition we can if you compare the blood smear, if we take the blood smear, we can see the macroovelocytes in case of RBCs. And if you want to examine that of the WBCs, so in case of the megaloblastic anemia, the another pathognomic feature is that we can also find neutrophils. They have hypersegmented. So hypersegmented neutrophils or polymorphic neutrophil can also see in this condition. So these are the structural changes in different sort of diseases. So thank you.